Guys, you're welcome to Just for Women Africa. My name is Olaleko Amusa, and you're welcome back after the holidays, Christmas. It's the new year 2022, and glad to have you guys back on the show. And today we have with us, who do we have with us?
Yes,
it's your show.
Yes, Dr. Eva. I'm right here with you for today's presentation.
Yes, we're back with time with Dr. Eva, and today we're going to be discussing cervical cancer.
Yes.
Right? But before we get on with that topic, we would like to do a review from last year's topic of fibroids, and we'll go through one or two questions people have sent before we start off with today's show. All right, and before the end of the show, we'll be announcing the next topic for the next show, so watch out for that. Do not log off. All right, so last year, was it December, November?
December. It was December.
December, yeah. We discussed the topic fibroids, right? And we'll just do a quick review. We'll first start off, what is a fibroid?
So we called it benign growth in the uterus of most women. Not every woman, but most women.
Most women.
Yeah.
Okay. And what are some of the symptoms of fibroids?
So it could come with abnormal uterine bleeding more excessively than you normally would bleed, or it could sometimes impact on your fertility. Some women end up having like enlarged abdomen or enlarged stomach, which they've mistaken for pregnancy. Those are the main ones I'd like to highlight on.
Okay, and what are some of the treatments available for women who have fibroids?
So for treatment modalities, you could either, depending on your fertility wishes, decide to take your entire uterus out so you don't have a recurrence of it, because truth is, fibroids do recur after they've been taken out. So you could decide to take the whole uterus off, so then they don't have the chance to regrow again. Or they could take out the fibroid noodles from your uterus, which most times we'll call that myomectomy in the hospital. Or we can do a hormone-based treatment where we'll give you certain medications to try and reduce the effect of that particular hormone that is leading to the growth of fibroid in a woman.
Okay.
Yeah.
All right. So if you have any of these symptoms or causes, you can go see a doctor. We have one or two questions which were sent in. One from South Africa and one from, wait, did she leave her country? Let me check. Okay, Uganda. All right. The lady from South Africa says she's been bleeding for 2 months, and she went to see her doctor.
Right.
And she's saying that her doctor diagnosed her with having a fibroid.
Right.
But the doctor is advising that it's not yet time for her to remove it, and she wants to know whether that's part of medical treatment.
Yes. Like I said early on, I mean, the treatment for fibroid depends on one's fertility wishes. If you're done having your planned family size, you can go ahead and then take out your uterus. But if you're in your prime years and you haven't even had a child before and you wish to have children, then we will not go in to take out your entire uterus. I will do a procedure we call myomectomy and take out the fibroid noodles and then give you a chance for you to be able to carry your babies.
Okay, that was good. All right, so that was Lisa from South Africa, and we have, I can't pronounce the name, from Uganda, but okay. So she said she had fibroids some years back, and it was taken out, and since then she's not been able to have a baby.
How many years ago?
Well, she didn't really indicate, but she just said some years back.
I think she just go back for them to do a panel of tests for her. Taking out fibroid doesn't mean render you infertile. You still have the possibility to get pregnant and then have children. So if she can't conceive post myomectomy, she should just go back. We need to check her hormones, make sure they're all within the same range. Everything is fine, and then we can talk about she being able to conceive again.
Okay.
Yeah.
All right, that's it. All right, so what we'll do for time with Dr. Eva is that we'll compile all the questions. Then one day on a show, we would sit down and answer all the questions people have sent, related health issues, and we'll take time to actually answer them. Right. So that'll be sometime during the year when we have a full pile of questions.
That's fine.
All right. And so we're going to start off with today's show. I mean, apparently January is the month for cervical cancer worldwide, and on Just for Women Africa, we're here discussing it. All right, so before we start the show, do not forget to hit the subscribe button. Tell a friend who knows a friend about Just for Women Africa.
All right.
leave a like, leave a comment. And we also like to thank our host, Thea Coffee House at Airport off the Patricia Lumber Road. They've been really, really nice to us and supporting us. We're actually here filming time with Dr. Eva. All right. So we're going to start off with today's show.
Right.
Now, before we start again, if you want to send your questions, you can send them to was it Eva at justforwomenafrica.com. This is the email below the screen. So if you won't have any questions, you can send your questions there, or to women at justforwomenafrica.com. All right. Cervical cancer.
Hi.
All right. So let's start. What is cervical cancer?
What is cervical cancer? Wow.
Cervical cancer. Cervical cancer.
Okay, so it's one of the third leading cancers in women, and like the name implies, it's cervix. So cervix is just like the opening of the uterus of every woman's reproductive system. So cervical cancer is cancer that affects the cervix of women, basically.
Okay.
Yes.
All right. So what are some of the symptoms if somebody has cervical cancer?
Okay, so cervical cancer goes through phases. It just doesn't start off as cancer. Now we have what we call cervical intraepithelial neoplasia. This is a big word, but it's very simple. So for this, basically it's like a pre-malignant lesion. That's how it starts. So it starts with the pre-malignant lesions. When they are not taken care of, then it becomes cancerous. So the pre-malignant lesions, it can be asymptomatic. It doesn't really cause any symptoms. You don't experience anything. And cervical cancer, actually, the disease progression is from 5 to 20 years. So it can go through all these years, being there quietly, just progressing from one state to another, depending on one's immune status and one's sexual activity and one's lifestyle also. It can progress to cervical cancer from the pre-malignant lesion. Now, symptoms that normally people with cervical cancer, when you finally have the cancer, will present with, they will either they bleed after sex. That's usually in the older women, the postmenopausal women. Or with women in the reproductive ages, they realize they have abnormal uterine bleeding, like they're bleeding excessively, more than what they usually used to experience during their menses. Or they've noticed that they have this burning sensation when they urinate, or they've noticed that there's this pungent malodor that comes from their vagina, from that area. All these are signs for you to go and see your doctor and find out what is going on with you.
Okay, that's interesting. Yeah. So you did mention that there's an odor that comes out. Yeah. Is the odor persistent, or it goes and it comes, or is there 24 hours?
It's there. It depends on how well the disease has progressed, but then it's there all the time. Anyone who gets close to you can perceive the odor.
Okay, that's interesting.
Yeah.
All right. So what are some of the causes of cervical cancer?
Causes. So, cervical cancer is basically caused by, let me say, two main factors which predispose someone to getting cervical cancer. Someone who doesn't practice safe sex, and someone who isn't vaccinated against cervical cancer. So in safe sex, there are a couple of groups that we need to pay attention to. Men sleeping with men and are bisexuals, because then it means they have female partners, and then they can transmit the virus to their female counterparts and then also spread it to other people. Now, women sleeping with women could also pass on the cervical cancer to their partners, especially when they use sex toys, because if one partner is also bisexual, she may have picked the virus from her partner and then transfer it from herself to you when they use the sex toys. Now, another means of getting it is those who practice oral sex. Yes, I know you're looking at me. Yes, you can get you sure can get cervical cancer because of the virus that causes cervical cancer that is found along the genital and then the oral route. So that is one means for you to get cervical cancer. And also the age at which you first have sex. Remember I said it takes a 5 to 20 year period before you finally get cervical cancer. So if you have sex at a tender age, you are more prone to getting cervical cancer later in life if you're exposed to the HPV agents. Okay, yes. And also, if you are not immunized against cervical cancer, you could also get cervical cancer. And if you are not doing regular screening via the pap smear test, you could also get cervical cancer. And lastly, for me to add, if your partner is practicing unhealthy sexual habits, it predisposes you to getting cervical cancer because they pick from their partner and gladly give it to you.
Wow, that's interesting.
Yeah.
But you did mention that while we were talking, one of the causes, you said having sex at a tender age.
Yeah.
What age would you consider tender
So
age?
usually, sex before 21 years is one of the risk factors to getting cervical cancer because you're exposed a bit earlier than they would expect the general population to be exposed to cervical cancer.
Okay, that's interesting. All right, guys, you're still watching Just for Women Africa. Do not forget to hit the subscribe button, leave a like, and tell a friend about Just for Women Africa. And today we're with today's show with time with Dr. Eva. All right, and today's topic is
Cervical cancer.
all right. So once somebody is diagnosed with cervical cancer, what are some of the treatments available?
Right. So, like I said earlier on, there are pre-malignant lesions before cervical cancer. There are two different entities on their own. So, the pre-malignant lesions, we diagnose it using the pap smear test. I'm sure some of us have come across it. So, we either do the pap smear test or we do the VI, that is visual inspection with acetic acid, which helps us to detect abnormal changes on the cervix and then institutes the early remedy or treatment to prevent you from getting cervical cancer. Now, these are early or primary modes of treatment. We call them screening methodologies to help us decrease the burden of cervical cancer on the society. Now, treatment modalities would be either we do cryotherapy, that we freeze to dislodge the abnormal cells, or we do LEEP, which is the loop electrosurgical excision procedure, where they use some thermal coagulation method to take out the abnormal cells and then allow for regrowth of the normal cells, prevent the progression to cervical cancer. Or we can do a cone biopsy of the affected area. Or if you're done having your family size, we could go ahead and take out the entire uterus. So then you don't have any. Well, the cervix is in there, the uterus is also not there for it to move.
But that's really extreme, huh?
That's really extreme. Yeah, but I mean, so that's one. Those are some of the modalities. Or if it's progressed to cancer and maybe stage 1, stage 2 of cancer, we can do chemotherapy to help clear the cancerous cells from the body.
Okay.
But if you move beyond stage 2 and it goes to stage 3, stage 4, they would have to do what we call palliative care. Even with stage 3, we can do some form of chemotherapy for you. But then if you move beyond certain stages of stage 3, you may have to do palliative care for you because then they could have gone to other parts of the body and the probability that chemotherapy will be able to mop up all the cancerous cells are pretty on the low side. So then we just have to do palliative care, manage the symptoms for you so you can have a better quality of life.
Okay, that's interesting. All right. So I was going to ask prevention,
right?
But I'm sure whilst we were talking, you mentioned this.
There's something else I wanted to add.
Okay, sure. So go ahead and just ask it.
So there's this thing about cervical cancer, like we all know, it basically affects women, but men are also culprits in a way. So with prevention, vaccination is the best form. Aside practicing safe sex, having stable sexual partners, which falls under safe sex. And then, those ones. We could also talk about the vaccination. So for vaccination, there are two vaccines, okay, that currently is being rolled out to help handle cervical cancer. We have the Cervarix, which takes care of serotypes 16 and 18, which actually are the culprits for causing cervical cancer. And then we have the Gardasil, which takes care of 6, 11, 16, 18, 31, 33, I think 45 and 58, yes. Now these two would help protect you from cervical cancer. You get it? Now with Gardasil, it has a broader coverage. It doesn't only protect you from cervical cancer, it protects you from genital warts, it protects for women. I'll come to men. Sorry, I know it's for women, but then let me also chip in because men are also culprits when it comes to cervical cancer.
Really?
Yeah. Because if you have the HPV virus.
We do.
You do, in a way.
We do.
You know?
We do.
But
okay. We'll have this conversation for after the show, behind the scenes.
So yeah, like so it protects you from genital warts, protects you from anorectal cancer, oral cancers, protects you from vulvar cancer, protects you from vaginal cancer. That's what Gardasil does. So it's a broad spectrum as compared to the Fibroids, which has only focuses on only 16 and then 18. So currently in Ghana, the vaccines are available, so you can pass through any health facility. I know in Accra, you can talk about Kolebu, both Kolebu Main and Kolebu Polyclinic. Mary Stoops is one area. We can talk about Ridge Hospital. These are some centers. We'll give you a list of centers for you to visit if you want to get tested. But then these are a few I can say off the head in Accra for you to visit and then get tested for pre-malignant lesions or possible cervical cancer.
Okay, that was interesting. All right, guys, you're still watching Just for Women Africa, and this is Time with Dr. Eva. Do not forget to hit the subscribe button, hit the like, and tell a friend who knows a friend about Just for Women Africa.
Right.
All right. So we've gone through the what is cervical cancer. We've done symptoms. We've done treatment. We've done prevention. Okay.
No, there's a picture that we'll see just after this section that will let you know how the disease progresses from the pre-malignant state till it becomes cancerous, and how it changes at the cervix and how it looks. So this is what we'd like you to take a look at.
Okay, so the picture should be coming on your screen right now. Okay, so basically there's no cure for cervical cancer.
There is cure for cervical cancer.
What, the vaccine?
Practice safe sex.
Oh.
Vaccines. Have a regular pap smear test. Now let me talk about the pap smear test.
Yeah, I was going to ask about that.
Oh, right. Okay.
So what exactly is a pap smear test?
So it's just a test. It's just a test where we sample cells from the woman's cervix to be able to detect abnormal changes and then intervene early to prevent it from getting cervical cancer. So would want me to talk about how the procedure is
Yes,
done?
I'd like to so that our viewers can know. Is it an injection they take? Is it just scrape your skin, or what do they do? Okay. What is exactly the procedure?
So I'll talk about the procedure, and I'll talk about when you can get it done, at which age brackets can go ahead to get a pap smear done. So you go and see your healthcare provider. You usually laid with your back on the bed. Okay. And your legs will have to be propped up. We'll pass an instrument we call a speculum. This is because the cervix is in there. We can't see it like how we can see your legs, your hands, your eyes.
The speculum, is it made from metal, plastic? What's it made
There are two types. We either have the plastic one, which is more common now in the healthcare setting, or we have the metal one.
Okay.
Yeah, so depending on which one your healthcare provider decides to use for you, it's passed through your vagina into your cervix, open up to help us to see the cervix because it's in there. Then would apply a little acetone or acetic acid with cotton wool on the cervix. Wait for like 3 to 5 minutes. Then we'll just watch for changes on your cervix. So the next image will just show you how the changes on the cervix will be after the acetic acid is applied on it. And that one would help us know that there are pre-malignant lesions going on your cervix, and there's the need for you to do a follow-up testing so that we can catch it early and then treat it.
Okay.
Yeah.
So how long does the test usually take?
Well, turnaround time after the samples have been taken should be like 2 to 3 weeks.
Okay.
So after the speculum is passed, usually depending on which ones you're doing, either the cytology, which is just the pap smear alone, or you're doing a code testing, which is the pap smear with the HPV DNA. We may use the traditional method of using a spatula, but now we use a brush. We pass it through the vagina with the help of the speculum, which has been able to part the vagina for us to see the cervix properly. We take samples from the cervix, fix it back into the liquid-based medium, and then send it to the lab for various testing to be done.
Okay.
Yeah.
So that's interesting. All right. So back to the next question. At what age should women get vaccinated?
Okay. So per current literature.
Wait. Before you probably answer that question, at what age should they start for the testing of the pap smear test?
Okay. So for pap smear testing, when you are less than 21, that's why I said the recommended age for coitus or sex. sex is 21 years. So less than 21 years, the WHO doesn't advise that we do any pap smear.
Why? So if they do a test on somebody less than 20, they wouldn't catch it, or what?
Not really, but you could still catch it. But per guidelines, we think it's better for us to do it from that. That's when we expect people to be more sexually active. Or do we know that's not the true picture that happens here? So from 21 to 29 years, you do a pap smear test every 3 years.
Okay.
Yes. From 30 to 65 years, you either do the pap smear test every 3 years, or you do the HPV DNA and the pap smear test every 5 years, which we call co-testing. Now with the vaccine, let me jump onto the vaccine question you wanted to ask. With the vaccine, like I said, there are two types, the Cervarix and the Gardasil. Going through literature on cervical cancer and vaccine use with regards to preventing cervical cancer, we'll let you know that there's an age bracket. We prefer it to be given in the younger ages, between 9 and 26 years, right? So even with that, we have an early phase and then a later phase. So the early phase is between 9 and 11 years for both boys and both girls, because boys could be carriers of the HPV, you know, they are not they are not left out. And then between 11 and 26 years. And this between 9 and 26 is the best time to get vaccinated against HPV. But that you are past this age doesn't mean you cannot get vaccinated. You can still get vaccinated. Yeah.
Okay, that's interesting.
And one thing to note is that HPV is common in like 90% of sexually active women. So that you have the HPV doesn't necessarily mean you have cervical cancer. And when you are less than 30, the body is able to clear it. I mean, if you are less than 30, your immune system is robust, like everything is okay, and you've been exposed to the HPV, your body can still clear it.
Oh, really?
It becomes a little challenging when you're past 30. I still was trying to get the mechanism surrounding why when you're past 30, the body is not able to properly get rid of it. But then that should also let you know that as you're aging, your body's ability to fight diseases becomes a bit impaired. Okay. So that's one thing. That's why we encourage frequent testing so that we can detect it early and then put in the right intervention to prevent you from getting cervical cancer.
Oh, that's interesting. Yeah. Okay. All right, guys, you're still watching Just Women Africa. Do not forget to hit the subscribe button, leave a like, leave a comment. And today we're on the show with Dr. Eva. Time with Dr. Eva.
Yeah.
She's even more popular than I am.
Hola.
Okay. All right. So, while I was doing my research on the topic, and a question kept on popping up, and it was being debated.
Okay.
Once you've been diagnosed with cervical cancer, should you still be having sex?
Hola.
I don't
if your woman has a mal odor from the vagina, would you go into her sex?
But you yourself said that it takes time before it progresses to that stage. So
it doesn't mean sexual activity ceases. But just make sure, I mean, like I said, that's two different categorizations. Cervical cancer is when you actually have passed the pre-malignant stages.
Oh, okay.
You get it? So let's get the distinction clear. That you have pre-malignant changes on your cervix doesn't mean you have cervical cancer.
Okay.
They are not the same thing. Pre-malignant changes would lead to cervical cancer. So it moves from pre-malignant to cervical cancer. And if you have pre-malignant changes on your cervix, you can still go ahead and have sex, but practice safe sex. Use the condom. Be protected. You're good to go.
Okay.
And do your frequent testing so that we can detect it early and probably put in either you do the cryotherapy or you do LEAP to just take out the abnormal cells. Now, if you move from pre-malignant to cervical cancer, maybe stage 1, stage 2, if you started your chemo, you've done your cone biopsy, you've taken out the malignant changes of those areas, you can still have a normal sexual activity. And when it moves to 3, moves to 4, my dear, there's no energy for sex, so body don't tire. Body don't tire. You cannot do sex. You say sex go fit do. Nothing go fit happen. You know what happens, sir. You won't even think about it. So that's how bad it can go. You get it.
Oh,
that's how bad it can go. Yeah.
That's sad.
And one thing I would like to add on it is that you've taken the vaccine against cervical cancer. Doesn't mean you don't do your pap smear test. You still have to do it.
Okay, so that's an interesting question. So once you take the vaccine, the likelihood of you getting
the cervical cancer is really reduced, but it doesn't rule it out. You still would, you still would have to continue with your pap smear test and your co-testing.
Okay.
Yeah, that's within from like 21 to 29. They do the pap smear test. Then from 30 to 65, you do the co-testing, that's pap smear and HPV DNA, or only pap smear test. Now, when you are greater than 65 years, usually in your postmenopausal age, and you've had negative results for your pap smear or the co-testing, there's no need to continue with the test again.
Okay.
There's
All
no
right.
need for it.
You know, well, you know, we're in a year of vaccines and all, and a lot of people are reading up on vaccines. Okay, so I want to know, so taking the vaccines, are there any side effects to a woman?
It will be user dependent.
Okay.
Like every vaccine that is taken, you could have a headache, you could have a fever, you could have some itch or irritation around that area. It could become reddened. You know, for those of us who are light skin, you can see an area. You can see the reddening area, or some could have like extreme ones. That would be like maybe a whole body rash. I don't know.
Okay. All right, guys. You're still watching Just for Women Africa. This is Time with Dr. Eva. Do not forget to hit the subscribe button. Tell a friend who knows a friend about Time with Dr. Eva on the Just for Women on YouTube. Now, I mean, we've been talking about cervical cancer and all that. It is Just for Women Africa. We might not know all the centers in Africa, but since we're shooting in Ghana and the origin of Just for Women is in Ghana, where are the various centers? Do you know of various centers where women can get screened for these things?
So the list, I'll give you the link so that we can give them the list from all across the country, especially in Ghana, where they could get tested.
Okay. All right. So that will be made available during the course of the program. You'll see the links of the various centers in Ghana where you could go get the test done. All right. We're about to round up. All right. So, Dr. Eva, what is going to be the next topic?
The next topic. What would women like to know about?
I don't know.
So issues that battle or come down with fertility. So I'm going to talk about polycystic ovarian syndrome, which in a way...
Wait, should I try and pronounce that?
Oh, you can try it. Try it and let me see.
So repeat it again.
Polycystic ovarian syndrome. Peacocks.
Or peacocks.
Yeah.
Polycystic
ovarian syndrome.
Okay. Peacocks. Simple. I got that.
Yeah.
All right. So, I mean, that will be treated on the next show, but can you just give us a summary? What is that about?
So it's more of a, let me say, it's a bit of a hormonal imbalance, which leads to the overproduction of one particular hormone that drives the whole change in the normal equilibrium of a woman's hormone, affects her menstrual cycle, affects her weight, affects her hair distribution, and affects her fertility also.
Okay, that's for next week. The next show.
That's right.
All right, guys. All right, so thanks for spending time with Dr. Eva here on Just for Women Africa. Do not forget to hit the subscribe button, leave a like, leave a comment. The emails will be below, either at Just for Women Africa or women at Just for Women Africa.
Right.
If you have any questions, you can send to us, and we'll be happy to treat them and put them into our folder, so that on that show, which is just dedicated to which is just dedicated to questions, and we'll just answer the questions, and Dr. Eva here would be helpful to answer all of them for us. All right. So we'd like to once again thanks our host, Thea Coffee House at airport off the Patricia Lumber Road. It's a really nice place. You can come here for breakfast, lunch, and hang out with your friends. Really nice environment. All right. So to the next show on the Time with Dr. Eva, it is...
Bye.